Chapter 23, Care of Patients with Brain Disorders. A focal seizure, also known as a partial seizure, affects only one part of the brain, leading to a localized clinical symptom. Partial seizures, also called simple or focal seizures, these result from an abnormal localized cortical discharge. Partial seizures with complex symptomology may also be called temporal lobe seizures because they usually originate in the temporal lobe of the brain. A partial seizure can be unilateral, meaning one-sided, with involvement only on one side of the brain and activity only on one side of the brain. In generalized seizures, these involve both sides of the brain or bilaterally, and usually the whole body if motor symptoms are present. Generalized seizures are characterized by bilateral, synchronous, electrical discharges in the brain. The whole brain is affected, and there is no warning or aura. The patient will usually lose consciousness quickly, and they are unconscious for a few seconds up to several minutes. Absence seizures, they may only last a few seconds. The onset is quick and sudden, there is no aura or warning, and no postictal symptoms. Seizures of this type tend to affect children between the ages of 5 to 12 and routinely disappear during puberty. A tonic-clonic seizure, there is continued contraction of all muscles, and the body becomes rigid. Usually, it'll begin with bilateral jerking of the extremities. There is a loss of consciousness with both the tonic and the clonic convulsions. An atonic or an akinetic seizure. This is characterized by loss of muscle tone throughout the body, resulting in nodding of the head, weakness of the legs, or total collapse and falling. The person usually remains conscious during the attack. Status epilepticus indicates prolonged partial or generalized seizure activity of 5 minutes or more, rather than one seizure without recovery attacks between. The diagnosis is made when the metabolic abnormalities, toxins, infection, or other reversible causes are ruled out, and 2 unprovoked seizures occur more than 24 hours apart. Status epilepticus is a medical emergency, usually caused by abruptly stopping anti-seizure medications. Surgical procedures for epilepsy usually involve removing the epileptic focus or preventing the spread of epileptic activity by focal cortical resection. An implanted vagus nerve stimulator is proving to be helpful for generalized epilepsy for many patients that have uncontrolled seizures. Ketogenic diet is beneficial in younger individuals with refractory generalized seizures that are difficult to control. The ketogenic diet provides sufficient calories from fats and proteins, but produces a ketotic or acidotic state that seems to prevent seizure activity. The diet is prescribed by a healthcare provider, and it is monitored by a dietitian. Biofeedback techniques are geared toward teaching the patient to maintain a certain brainwave frequency that is not susceptible to seizure activity. If the nurse sees a seizure happen, the nurse should make sure to note the time the seizure began and the time it ended. Add what was the patient doing prior to the seizure, where the seizure started in the body, were the eyes moving, which side the head turns, whether the patient cries out or screams, makes any sounds, where there is any repetitive movements, maybe chewing, pinrolling. Further notations the nurse should make are the movements bilateral and symmetrical? Is the patient incontinent of any stool or urine? Do they vomit? Do they froth at the mouth? Are there changes in skin color, or is there profuse diaphoresis? For the postictal assessment, the main problem statement for a patient who experiences a seizure is potential for injury because of the seizure activity. Maintaining therapeutic levels of an anticonvulsant medication is vital to help prevent the onset of seizures. The nurse needs to educate the patient related to self-care for an epileptic, and requires that they understand the nature of their disorder, the reason for the medications, the medication side effects, as well as the signs of toxicity of medication that should be reported to the healthcare provider. A trans-ischemic attack is defined as a change to a transient episode of neurologic dysfunction that is caused by focal brain, spinal cord, or retinal ischemia without acute infarction. A TIA are usually caused by a brief interruption in the blood flow to the brain. Narrowed arteries and vascular occlusions, maybe by a small emboli or a vasospasm, will actually cause the interruption. Recreational drugs that constrict vessels also may cause TIAs. A trans-ischemic attack is a warning sign that a more serious neurologic event may occur. 10% to 15% of patients who experience a TIA have a stroke within 90 days. The period to initiate treatment for any type of TIA or stroke is within 4.5 hours of the onset of the symptoms. Cerebrovascular accident, or a CVA. This is the result of an interruption of the blood flow to a specific area of the brain. The stroke can happen in two ways. It either can be hemorrhagic or ischemic, meaning that the brain has a bleed or there is dead tissue. There are modifiable risk factors that we should, as nurses, make patients aware of. Cigarette smoking, recreational drug use, drinking alcohol frequently, heart disease, diabetes, sickle cell disease, an unhealthy diet, high blood pressure, high cholesterol, being sedentary, having former TIAs, oral contraceptives or hormonal replacement therapy, and obesity. Now, there are also non-modifiable risk factors for a CVA. One are patients ages older than 65, heredity, there might be a family history of a stroke, having a prior stroke, Race: African Americans, Hispanics, American Indians, and Alaskan Natives have a higher risk rate. Gender: the incidence is higher in women. The most common cause of a stroke is cerebral ischemia. The ischemia of cells directly causes cellular necrosis or death, and an infarct, an area of tissue that has become necrotic from the lack of blood supply. Ischemia can be caused by a cerebral thrombosis, which is a blood clot in the cerebral artery, or an embolus, which is a traveling clot, fat, bacteria, or any type of tissue debris that would lodge in the vessel and occlude it. This slide depicts the major arteries that supply blood to the brain. Blocking any of these major arteries can cause a cerebrovascular accident. These are the dangers of using the recreational drugs, cocaine and methamphetamine. An aneurysm is a ballooning of an arterial wall. When the arterial wall balloons, it becomes thinner, making it more prone to rupture. A cerebral arteriovenous malformation is a cluster of vessels that permit the blood to continuously flow through that site in a circular motion. Note the arteriovenous malformation, and you can see down there the ballooning showing the large aneurysm. For the warning signs of a stroke, if any of these occur, as a nurse, we should ask someone to smile, shrug their shoulders, repeat a sentence, tell you their name and where they are. This will indicate to us that this individual needs immediate assistance. Each specific area of the brain will control a particular activity. Recombinant tissue plasminogen activator is used to help dissolve clots and emboli in an ischemic stroke. It must be administered within 3 to 4.5 hours of the onset of the patient's symptoms. If this plasma activator, or TPA, has been given, no anticoagulants or antiplatelet aggregation drugs are provided for 24 hours. The drug is not administered to anyone with a known risk of bleeding or anyone that has had an intracranial bleed prior. Neurologic signs and the level of consciousness are watched closely to detect any deterioration of the patient's condition due to further bleeding and a rise in intracranial pressure. Approximately 80% of all stroke patients will survive the first or initial phase of the illness. Rehabilitation and plans for self-care are the utmost importance for the patient. Immediate assessment of breathing and the respiratory rate is vital. Level of consciousness is assessed next. Complete hemiplegia is a common effect of stroke. Aphasia will often indicate ischemia of the brain cells on the left side of the brain, and usually accompanied by right-sided hemiplegia. Because the patient that has had a stroke is at risk for a second occurrence, assessment for new signs of neurological impairment is ongoing. This means the proper positioning, range of motion exercises for any affected limbs, adequate nutrition and fluid intake as well as output, prevention of pressure ulcers, use of devices to keep extremities in anatomic position, and all nursing measures are directed toward maintaining normal body functions until the patient is able to maintain them on their own. The comparison of deficits and behavior related to damage to the left and right side of the brains is vital. The acute rehabilitation phase starts in the acute care facility and transitions into the acute rehabilitation inpatient setting. The degree of rehabilitation needed will determine the length of stay at the facility. After acute rehabilitation, plans are then designed for discharge and the referral to other individuals and agencies outside of the facility that will provide help to the patient as well as the family adjust to their new way of life. Most brain tumors are benign and not cancerous. Malignant tumors are primarily 78% of those that arise from the glial cells. Glial cells include astrocytes, ependymal cells, and oligodendroglial cells. Tumors are classified according to the type of cells that produce the malignancy. Neoplasms confined within the skull are space-occupying lesions, and therefore they will create problems of increasing intracranial pressure by compressing the brain matter. Radiation may be delivered as whole brain radiation therapy. They may also use a stereotactic radiosurgery, or they may use what's called brachytherapy. If blood has leaked into the ventricular system, it will interfere with the reabsorption of cerebral spinal fluid. Therefore, it will cause hydrocephalus. Hydrocephalus is an obstruction of cerebral spinal fluid flow that may require placing a shunt to reduce the cerebral spinal fluid pressure and prevent an increase in intracranial pressure. A shunt is a tube that is placed in the ventricle of the brain and attached to a valve system that opens when the pressure from the fluid raises to drain the excessive cerebral spinal fluid from the ventricles to the peritoneal cavity or into the atrium of the heart where it is absorbed. Brudzinski sign can be elicited by placing a hand behind the patient's head and with the other hand on the chest, gently flex the patient's neck forward by moving their chin toward the chest. If there is flexion of the knees and hips when you try to flex the neck, the Brudzinski sign is positive and indicates meningeal irritation. The Koenig sign position the patient supine and with the hip and the knee flexed at 90-degree angles, slowly extend the knee. If there is pain, not just discomfort, behind the knee, the Koenig sign is positive and will indicate meningeal irritation. The successful treatment of meningitis and the prevention of permanent disability depends on early recognition and prompt treatment. The disease usually responds very well to IV antibiotics, followed by oral doses of antibiotics given for a total of 10 days. Dexamethasone, a steroid, is provided along with the antibiotics, and it has been proven beneficial to decrease the inflammation of many patients. Viral meningitis tends to be milder than bacterial meningitis. A CBC, or complete blood cell count, will show an increase in the lymphocytes of the white cells. Encephalitis is less common than meningitis. Encephalitis is an acute inflammation of the brain that can be serious and sometimes fatal. Herpes simplex virus 1, the West Nile virus, and the enteroviruses are the most common types of viral encephalitis in the United States. A brain abscess is a collection of purulent material in the cavity within the brain. A bacterial infection that has traveled from the gums or the teeth, the sinus, the ear, or the mastoid region to the brain usually causes the brain abscess. Abscesses can form from bacteria introduced at any time during any type of a head injury or cranial surgery. Signs and symptoms that present are a headache, fever, and then progression to lethargy and confusion. Headaches are the most common cause of complaints of pain. Headaches are routinely caused by allergy, sinus problems, tension, or they may be vascular in origin. Migraine headaches are experienced more by women than men. The attacks will routinely occur irregularly and may begin with an aura, such as some visual disturbance or spots before the eyes, known as scotoma. There are known foods that may cause or trigger migraines: alcohol, caffeine, chocolate, artificial sweeteners, monosodium glutamate, some citrus fruits, meats that have nitrates, salt, foods that contain tyramines. Cluster headaches are higher in men. A cluster headache causes the most severe headache pain. The pain has an abrupt onset and it will usually last 30 to 90 minutes and may start during sleep. The headache may recur several times a day, and clusters usually last 2 to 3 months. Tension headaches are common, but they're not as severe in pain as a migraine or a cluster headache. A tension headache routinely involves neck stiffness and limitation of the range of motion of the neck. Trigeminal neuralgia is a rare facial pain syndrome, and it is caused to the pressure on the nerve root. Pain is localized on one side of the face. It rarely is bilateral. It can extend from the midline of the face across the cheek and jaw to the ear. The attacks are usually triggered by exposure to a draft, light touch or vibration, drinking cold or very hot liquids, chewing, brushing the hair, shaving, or washing the face. Trigeminal neuralgia involves one or more branches of the fifth cranial nerve, or the trigeminal nerve. Bell palsy is a weakness or a paralysis of the muscles supplied by the facial nerve. It usually affects only one side of the face and usually occurs in individuals older than 30 years. Recovery is individualized. Some individuals with total paralysis may not achieve full recovery, but will improve as the inflammation declines. Between 80% and 90% of patients recover completely within 6 weeks to 3 months. Bell's palsy can recur in 10 to 15% of the population of patients.